Hey everybody, this is Greg with Medical Muscle. And in this video, I want to talk about what my experience is like in the psych rotation for clinicals. Just off the bat, clinicals for psych is 6 weeks. Most rotations are 6 weeks, except for internal medicine and surgery, which is 12. But this is 6 weeks, and it's broken up into different parts of psych. So it's kind of cool. You get to see a little bit of everything. My first 2 weeks were inpatient. These are people who had basically been admitted to the hospital, self-admitted, and they needed monitoring basically throughout the day. So that's why they were there, either through drug rehab or having suicidal thoughts. They needed to be monitored. That was inpatient. Next, I did concierge for the next 2 weeks. So this is part of psychiatry that is really cool. You go into the general hospital, you go to the emergency department, you basically do a little bit of everything. It's for patients who have come in for a medical condition, but psych is required to go and visit them for some reason. So say if they've had a knee surgery and sitting in the hospital, they start feeling depressed. That's where we come in. Or, they have a fall and they've hurt themselves, but it turns out that the fall was due to a benzo addiction. So, it's kind of cool that you get to see a little bit of everything in that branch. And currently I'm in 1 week of outpatient, which is patients who we had seen in the ER or an inpatient, and now they're getting treatment outside, and you get to see the benefit of how some of these people do. And then the last week that I do is in the ED, so just in the emergency department, so anything that's psych related with that. So that's the 6 weeks. Obviously, it's gonna be different for every person. So I usually try to get to the hospital about 8:30 a.m. That gives me enough time to go through all the patients that preceptor has for that day, and which could be anywhere between 3 and 6 patients. In the note, you're looking at their medications, past medical history, any hospitalizations. You're making note of their vitals, you're making note of their lab results. So you're writing all this stuff down so that if the doctor asks you questions, then you know how to answer them. You're also ready for the patient so that when you go in there, you already have a picture of what's going on. So the encounter usually goes about 10 to 20 minutes. It's pretty relaxed. We just let the patient talk as much as they want. We're not in a rush, which is really nice. After we leave, the doctor and I will discuss the patient and what their treatment options are, and to ask questions. This is the time for you to learn, because oftentimes I've noticed while doing UWorld, I've seen cases presented in UWorld that are exactly the same as the case that I saw in real life, and I can answer it very easily. So then what I'll do after seeing some of these patients, I will do probably half of those patients. I'll write their notes. The other half, the preceptor, the doctor, writes those other notes. I basically explain everything that I saw, everything that was said, anything that needs to be added in, and I submit it. And that's basically it. For school stuff, while at the hospital, we will have a 1-hour lecture roughly every other day. It's on some topic that we need to know, like for psych, drug addiction and the drugs that you can use for treatment and whatever. That was our last one. One previous was on dementia. It's 1 hour. You don't have to prepare for it. You're not taking notes. You don't have to. I don't. And it's a small Zoom meeting. So it's only with the students that are rotating in psych at SGU, which is 6 of us. So it's pretty open for you to ask questions if you need to clarify something. It's the perfect time. Usually the lectures are pretty light. It should be stuff that you already know, give you a different picture of, that topic. All right, while I'm at the hospital, I'm usually pumping out UWorld questions. When, I have spare time, I usually get quite a few questions done. You can get a lot of work done there. And then the latest I get out is 5 p.m., but oftentimes we get released earlier than that, because if there's no new patients coming in, precept will just be like, hey, go ahead and leave. So it's pretty relaxed. I think on average you're working at least 6 hours a day, I would say, but you have some time in that to do a couple questions. Some specialties, obviously, you're not going to have time, but psych is kind of relaxed, and I felt like in my case at my hospital, that's how it's been. So let's talk about the requirements that you need for SGU, all right, and the hospital. It's kind of a mixture of both. So you're doing UWorld. That's the big study question bank that you're going to use while in clinicals. You try to do them while you're there if you have any spare time, but then when you get home, you're just doing it at home. For me to have finished the question bank in just one pass through the 6 weeks, I only had to do like around 10 questions a day. I've already finished that, and I'm already halfway done with my second pass. So, you really have a lot of time to just do a lot of questions. I'm still doing Anki, but I have made far, far, far less than I needed to in the past. The way I do Anki now is while I'm doing UWorld, if I get a question that I don't fully understand and I got right, I'll make an Anki card of it. Or obviously if I get it wrong, then I'll make an Anki card of that. And I'll go through the wrong answers, make sure I know what those things mean. I should be able to answer all the wrong answers too and know why they're wrong, right? Pretty straightforward. And that makes my Anki load pretty light. I think I'm doing maybe 30 cards a day, maybe 40, and that's including review. So it's pretty light. You have Firecracker, which SGU gives you. So they give Firecracker flashcards. It's very similar to Anki. They're really quick, short, little questions. And then at the end of every week, usually I try to get them in by Sunday, but they're due Monday at noon, but I don't want to put myself into that stress. So Sunday, I'll do the weekly required quiz. So you just take the quiz. It's 25 questions. It's kind of like your ESOF quizzes, pretty much. But it's just on the topics that you've covered for that week. SGU doesn't have lectures during this period. So the studying is all on you. You can kind of pick how you want to study. SGU gives you suggested YouTube videos on topics. They're like anywhere from 3 to 20 minutes long. They're pretty straightforward. They're all things you can find on YouTube for free. And I just go through those videos when I'm working out or, when I have some spare time, listen to those. That's kind of like your lectures. You don't have standard lectures. It's pretty light with the material that you should need to know, especially for psych. It's more like just reminding you of certain conditions and then adding in a few nuances that you never learned. Then you have patient logs that you have to do throughout your rotation. I had 11. I had to see 11 different types of psychiatric conditions throughout my time doing clinicals. And I finished that halfway through. I saw basically all the things that SGU wanted me to see. You just document it. You just make a little note of what you saw. Pretty straightforward. And then every other week, we have a case report due to the head preceptor of that department. So a case that you thought was really cool, I do a write-up of that. I write all the details of, their past medical history, their medications. The preceptor gave us an outline. It was really straightforward. So it's just plugging in these little things that she had made a document for. Really straightforward. You submit it, and that's your participation. Then you do a case presentation. You have one case presentation throughout your 6 weeks. It was pretty easy. It was via Zoom, so you could use notes. It wasn't like anything hard, really laid back, very easygoing. You have to do one full patient encounter on your own. It's pretty easy. You're in the first 2 years and you're doing a patient encounter. You're not allowed to use notes. Well, guess what? With the patient encounters, I was allowed to use notes because when I'm doing my mini mental status exam, I have a sheet that I read off and I have to have them write on it. Okay, so I don't have to do it all from memory. That's the nice thing. You may not get that, but more than likely you will. You'll have like the MOCA. That's one of the mental status exams that you can do. And so that'll be part of your physical. Really, it comes down to you knowing what kind of questions to ask, making sure that you collected all the information that you could, and also, remember patient comfort and respect and things like that. You still have to do that, obviously. you got to ask for a letter of recommendation from one of these doctors. So make sure that you're respectful and, you know, you are showing that you, not only respectful, make sure that you're covering everything about the patient that you can, because you want to show the doctor that you know you're interested in this and you're prepared. It's a little, I'm gonna say it's probably a little bit of a burden to the doctor because it just slows things down just a little bit. Sometimes they want to hustle. So your job is to make their life easier. You're helping them, basically. If you're good with what you do, then you're helping them be the best version of them. Say if they've missed something about the patient and you can inform them of it, then it helps the patient and it helps the doctor. It's really good. So that can help you get a really good letter of recommendation. If you're there to help, think about that, right? And that you can only help if you're making sure to put in the work and basically know everything you need to know about the patient, and also being up to date with medications, okay? And oftentimes, this is kind of cool, carry your phone in your pocket, make sure you're Googling drugs, look at the side effects, look at their mechanism of action. You need to know all those things. You need to know shelf exams. So it helps with everything. Like 2/3 of the way through our clinicals, we schedule our shelf exam at the end. So we get to choose which day, either Friday, Saturday, or Sunday, and the time. And basically studying for that, for me, I'm doing UWorld. I'm doing a second pass through UWorld. I do Anki. I do the firecracker stuff. I'm watching those YouTube videos. And I take NBME exams. The NBMEs are a lot shorter. They're only 50 questions. And you just use those to gauge how well you're doing. And that's basically it. So far, I really like psych. There's obviously some tough parts because you're seeing people sometimes at their very worst. Some of them have either thought about committing suicide or have attempted it. So you're dealing with these people. You're dealing with people who have had traumatic experiences in their life, very traumatic. But all in all, it's extremely interesting and it's very fun. I think you guys are gonna really enjoy this specialty. But who knows? I haven't done all of them, so I may change my mind. All right, guys, I hope you kick butt and I hope you enjoy clinicals too.